TGN 125 Ethics and Laws in Nursing Medical Negligence Part 2. The second element of negligence that need to be proved by the plaintiff is breach of duty. The defendant breached this duty. Breach of duty is that the behavior or inaction of the defendant in the circumstances did not meet the standard of care, which a reasonable person would meet in the circumstances. What is breach of duty? Breach of duty is often referred to as liability or a deviation from standard of care. The standard of care is the degree of skill, care, and judgment a reasonable, prudent, similar health care professional would have exercised in similar circumstances. The healthcare professionals are not required to deliver the highest degree of care possible, but they are expected to deliver standard of care. For better understanding regarding this matter, we will see the examples. Example number 1. During a nasogastric feeding procedure, a nurse gave 150 ml of milk to an unconscious patient without performing the test to confirm that the tube is inside the stomach because she was in a hurry and forgot to do so. The patient's vital signs deteriorated due to the pulmonary aspiration. Did the nurse breach the standard of care? Yes. The nurse should perform 3 tests before start to give the milk to the patient. The test will provide evidence that the end of the tube is inside the stomach and not misplaced to the larynx or respiratory system. Pulmonary aspiration means the milk has entered the larynx and the respiratory system. Can the patient die from aspiration? Yes. There are possibilities that the patient could die due to the aspiration pneumonia, especially in elderly. Aspiration pneumonia will occur after the milk has entered the lung. Example number 2. During the administration of an oral medication, a nurse gave a woman a medication that did not prescribed by the doctor. The incident occurred because the nurse was asked by her colleague to give the medication and she just took the medication and gave it to the patient. What should the nurse do before giving the medication to the patient? In the first place, are we encouraged to implement such practice? Do you still remember in the previous slide, the previous Minister of Health have mentioned that the incidence of medication errors was increased. This is one of the examples of practice that could lead to the medication error. The third element of negligence that need to be proved by the plaintiff is the breach of duty caused the harm. The breach of duty caused the harm, that the damage was caused by the breach of. We will go to the next slide for further explanation. The plaintiff should prove that the cause of the damage that he or she experienced either physically, emotionally, or economically comes from the negligence action. The damage should not arise from common complications or side effects. Complication versus liability. Known or commonly occurring complications or side effects do not typically constitute liability. However, be mindful that an unusual complication may well suggest a breach of duty. What is complication? Complication is a secondary disease or condition aggravating or irritating an already existing one. For example, a patient developed complication after a surgery. And what is liability? Liability is things likely to put one at a disadvantage, which means that the damage that occurred to a person has become liability for her or him. For example, among 10 patients undergone leg amputation surgery, only one of them being amputated at the wrong leg. So, this might come from a negligence action. However, it still needs to be investigated for the decision. Failure to recognize and appropriately treat complications in a timely manner may be considered liability. For example, a woman gets a complication after a cesarean section delivery, which her wound becomes infected. Because of the delay in the treatment, the infected wound becomes severe and causing septicemia, which is the infection enter the bloodstream, and the patient dies because of septicemic shock. Thus, it becomes liability. We will have a look at the first example. A patient falls out of bed. A 75-year-old patient was diagnosed with dementia and having a problem with eyesight. He cannot perform his daily life activities by himself. He needs to go to the toilet. A moment before, a nurse came to see him to tidy up his bed. Unfortunately, the nurse did not raise his bed rail before she leaves the patient, and the patient fell while he tried to go down from the bed because he wanted to go to the toilet. What do you think will happen to the patient when he fell down on the floor? If the bed is high, what will happen to his head, his bones, and other parts of his body? At the age of 75 years old, do you think his bone is strong enough to stand such impact? So, this is not complication, this is liability, and the harm was caused by the breach of duty. Example number 2. Pressure sore developed. A fully bedridden patient needed 4-hourly positioning because she was unable to move due to her disease process. Furthermore, she also an obese woman with a weight of 103 kilograms. A nurse who in charge of the patient did not change the patient to other position during her 7 shift hours, and the patient was laid down in supine position. After the 7 hours, the patient's skin turned red and warm. What the skin is trying to tell us? The skin is telling us that it was inflamed. It received so much pressure, and the skin will break down at any time because it is not healthy anymore. And the problem arises because of the patient was not turned to other position regularly to reduce the pressure. This is not complication, right? Because it can be prevented. If the area develops pressure sore, it will become liability to the patient.